Video lecture Chapter 18, Introduction to Dental Imaging Examinations. Intraoral imaging examination. Types of intraoral imaging examinations. We'll talk about complete mouth series, diagnostic criteria for intraoral images, an inspection of teeth and intraoral adjacent structures, and requires the use of intraoral image receptors. Intraoral receptor is a receptor that is placed inside the mouth and used to examine the teeth and supporting structures. Types of intraoral imaging examinations: periapical examination, interproximal examination, and occlusal examination. The purpose of a periapical examination is to examine the entire tooth and supporting bone. We will use a periapical receptor, and to capture the image, we will use the paralleling or bisecting technique. The purpose of an interproximal examination is to examine the crowns of both the maxillary and mandibular teeth on a single film. We will use the bite wing receptor and the bite wing technique. For the occlusal examination, our purpose is to examine large areas of the maxilla or the mandible on one film. We will use the occlusal receptor and the occlusal technique. A complete mouth series or full mouth series could be known as CMS or FMS or FMX. A full mouth series of complete series. So we're looking at all tooth-bearing areas, edentulous or edentulous. Diagnostic criteria for intraoral images. Our images must show images with optimum density, contrast, definition, and detail. Must show images with the least amount of distortion possible. The CMRS must include images that show all tooth-bearing areas. Our periapical images must show the entire crown and root of the tooth that is being examined or teeth, as well as 2 to 3 millimeters beyond the apex. And the bite wing images must have open interproximal contacts. Extraoral imaging examination is an inspection of large areas of the skull or jaws. We would use the extraoral receptors. These are receptors that are placed outside the mouth. And examples of our extraoral images include the panoramic, lateral jaw, lateral cephalometric, posterior anterior, and Waters. Prescribing dental images. This is based on the individual's needs. The dentist uses professional judgment to make decisions about the number, type, and frequency of dental images. Not all patients will need a CMS. CMRS is appropriate when a new adult patient presents with clinical evidence of generalized dental disease or a history of extensive dental treatment. Otherwise, a combination of bite wings, selected periapicals, and/or a panoramic image should be prescribed on the basis of a patient's individual needs. This concludes our lecture.